Hi, my name is Allison Weiss, and I am doing my health policy presentation on Roe v. Wade. As many people are familiar, Roe v. Wade is a Supreme Court ruling that significantly impacted healthcare for millions of women in the United States. It is both a federal and a state policy issue, and it was overturned in 2022, allowing states to govern abortion laws rather than having a federal law that applied to all of America. So the Supreme Court ruling, when it was ruled back in 1970s, it was the federal law of the land, but when it got overturned, the power to make decisions about abortion were left to the states. Access was lost for millions of people and their right to an abortion. And many women are now living in states with total abortion bans and are forced to traveling to other states. Roe v. Wade was a 1973 court ruling made by the Supreme Court. I did not know this until my project, but Roe was actually an alias name. That wasn't really her name, but she was receiving so many threats that they had to make her name private. She originally filed the court case because she wanted to have privacy when making her decision to have an abortion, and it eventually made its way all the way to the Supreme Court. The Supreme Court ruled that abortion rights and the decision to have an abortion is an individual, very personal decision between the patient and the provider. The Supreme Court ruled that this is an essential human liberty and human right to promote personal decisions about family and bodily autonomy. Roe v. Wade received a lot of pushback from a lot of politicians and lawmakers, as it does today. Between 1973 and 2021, many states in the United States enacted over 1,000 abortion restrictions in America. In 2021 alone, there were 600 bills introduced to limit abortions, and 108 of them passed. In the 1990s to the 2000s, states were able to develop more restrictions such as waiting periods, mandatory ultrasounds, consent from parents if the patient was a minor, and sexual partners in some states had to be made aware of the other partner having an abortion. So even if it was a man this woman met one time and knew she wasn't going to date, etc., they had to be notified that their sexual partner was going to be having an abortion. Waiting periods means if they showed up to a clinic wanting an abortion, some states required 24 to 48 hours for the woman to think about their decision. Some states required counseling, which could sometimes be biased into convincing people to carry the child and put them up for adoption, that sort of thing. And mandatory ultrasounds sort of could be a little bit biased because maybe the mother didn't want to have an ultrasound, so they didn't have to see the fetus or hear a heart tone or something like that. And some states started to require the mother to go through an ultrasound no matter what. So when Roe v. Wade was established and the Supreme Court ruled and made the decision that women had the right to privacy and the right to an abortion, immediate implementation went into order to protect women and their rights to an abortion. State bans on abortion were immediately invalidated, and every woman in every state had access to a safe abortion. Roe v. Wade set guidelines for a trimester framework because each state had really different rules on what was allowed for abortions. So Roe v. Wade decided during the first trimester, the state could not interfere at all. They could not say anything about fetal heart tones, that kind of thing. Any woman in the United States in the first trimester was allowed to have an abortion. That was a decision between the pregnant woman and the provider. The second trimester states that the states did have a little bit of regulation regarding abortion, but it had to be for maternal health. So that's what the law was. During the third trimester, states could restrict or ban abortion except when it came to saving the mother's life or long-term health. Since Roe v. Wade was a Supreme Court ruling, it was not promoted in the way that other health policies are usually promoted. Roe v. Wade had the whole nation locked in. Everyone knew that this was a really hot topic, and they were really eager to see which way the Supreme Court would lean. And the second that it got announced, radio shows and news channels were announcing the news of Roe v. Wade, just like people tune in to the radio and news channels today to hear about verdicts of different court hearings. It was covered by CBS, CNN, and Fox. It was all over the newspaper. And advocacy groups would rally and give speeches regarding abortion laws. The National Abortion Rights Action League, which is now known as Reproductive Freedom for All, they're an advocacy group that partnered with people like Planned Parenthood, who we still know of today, and they helped raise awareness for abortion laws and legalizing abortion. So after Roe v. Wade was implemented, there was a lot of data supporting that abortion really helped women. So underserved populations such as African Americans, Hispanics, and unmarried women were receiving safer abortions. Studies have shown that African Americans significantly had higher economic outcomes than white women when they were allowed access to an abortion. Women were completing college degrees and staying in their jobs, so since they weren't being forced to carry their child, if they had an abortion and they were in college, they could continue with their degree. And the studies show that women who had an abortion were able to stay at their job and they weren't forced to quit to raise a child. So labor earnings and women in the workforce actually went up. And teen birth rates decreased, so teenagers who are known to be pretty reckless, they, if they got pregnant, they usually, even still to this day, end up taking a lot of time off school. Some drop out of school. And when abortion was allowed, teenagers could safely have an abortion and they could stay in school and graduate and then work in the workforce. Women were able to stay closer to their home for an abortion. They were not forced to travel to another state where it was legal. They could spend less money on their care, their gas, child care, things like that. Obviously, maternal deaths increased. So before Roe v. Wade, maternal deaths were very high and pretty significant because women were not having safe abortions. They were not able to see a doctor for maybe the reasons I talked about. They didn't have the time to drive to another state. They didn't have a car. They didn't have gas money. So they were doing what was possible and most feasible for them, which could be a really safe and illegal abortion. Legal abortions increased to 1.6 million in 1980, and the number of illegal abortions significantly decreased. So the daily operations of abortions, the procedure itself didn't necessarily change, but medical operations were able to be performed by OBGYNs who were trained in it. And abortion and women's health clinics were starting to open in every single state. There were multiple of them in some really big states. I know West Virginia had one. Physicians and providers could safely perform abortions without being scared of imprisonment, law enforcement, or prosecution. Patient care improved. Women were getting safer abortions and they felt more comfortable, and they themselves weren't scared of judgment or persecution. Law enforcement no longer had the grounds to arrest anyone for getting an abortion or arrest a provider for aiding in the abortion. And as I mentioned, women no longer had to travel distances to get an abortion. They did not have to cross state lines. They didn't have to search for multiple different clinics and see who would offer one. This saved women a lot of time and a lot of money. Women were given the autonomy and the personal decision as to who they wanted to have a child with and when they wanted to have a child. And women could spend a lot more time focusing on family they already had, their career, graduating from school, and maybe having the finances and being financially prepared to have a child. Before Roe v. Wade, single parent rates were really up as they are right now, and a lot of children are not being raised by their mother because maybe they were forced into having their child. So, as I've mentioned, Roe v. Wade was highly effective and it had a really great impact on the economy, women's lives, and safety. Women were allowed to stay in the workforce, they improved the economy, and women had more autonomy. Before Roe v. Wade, abortions were being performed illegally and unsafely and resulted in the death of many women. Illegal abortions were resulting in the death of a lot of women. And after Roe v. Wade, women were getting the same abortion care regardless of which state they were in. And there was a standardized level of care across the board. If you lived here, if you lived there, you had the right and access to a safe abortion, because racial equality was a really big factor in this. And it was proven white people had better access to an abortion than low income, poverty, African American, and Hispanic women. They did not have the same access to an abortion because they did not have the money or abilities to travel to another state in the way that white women did. There was a really significant gap and disproportion of access amongst racial groups and income levels on who was receiving abortions. So in 2022, Roe v. Wade was overturned by the Supreme Court and the national right to an abortion was taken away from millions of women. This was the first time in 50 years that the Supreme Court had removed a fundamental right. More than a dozen states have outright banned abortion, and millions of women have faced the impact. Women are forced to drive hundreds of miles to have access to an abortion. So, like here in West Virginia, it's pretty much a total ban on abortion. And if you want to have an abortion and you live in West Virginia, you're going to have to drive to Columbus, Ohio, Pittsburgh, Pennsylvania, and pretty much a good 3 to 4 hour drive to receive care. Providers were forced to make decisions about abortions, so when Roe v. Wade was overturned, initially a lot of providers were really nervous. What was allowed, what wasn't allowed, which law were they supposed to follow, and a lot of women were kind of scared, what's happening with me now? What if I have an ectopic pregnancy? What if I hemorrhage? What's going to happen? A really significant statistic is that 30.8 million of women do not have access to an abortion within a 30-minute drive now. And 29.3 women do not have access within a 60-minute drive, and 23.6% of women do not have access within a 90-minute drive. So almost 25% of women in the United States have to drive over an hour and a half to have an abortion. In 2020, 1 in 10 women were having to drive to another state to get an abortion, and that has worsened since Roe v. Wade. And women now have to face increased cost of an abortion and needing to travel across state lines, maybe find childcare for the child that they already have, and take off work, pay for gas, and all of that to go have an abortion. And abortion bans actually increased U.S. spending by $61 million because women are being pulled from the workforce to raise a child. And when they're being pulled from the workforce, it's a significant loss in earnings for women and children. After Roe v. Wade was overturned, abortion rates actually went up because they're still happening despite the change. In 2023, there were 1.05 million abortions, and in 2024, there were 1.14 million abortions. This could be due to improved access after the overruling, mailing abortion pills, and telehealth. So a lot of places started to figure out, what can I do now that Roe v. Wade has overturned? And a lot of places have got really diligent about trying to mail abortion pills and allow telehealth, whereas this wasn't really popular before. So abortions are still happening, whether they're safe or unsafe, but a lot of places have tried to come up with other ways to provide abortion rather than being forced to go to a clinic. So, a little bit about West Virginia abortion laws. Abortion is completely legal in West Virginia. It's only allowed in the exception of a non viable fetus, ectopic pregnancy, and medical emergency. Survivors of rape and incest can obtain an abortion in the first 8 weeks of pregnancy, but this is only allowed if the rape or incident is reported to law enforcement first. Victims who are minors can have an abortion up to 14 weeks if it's from rape or incest, and that still has to be reported to the law. After Roe v. Wade was overturned, the law in West Virginia reverted back to the law made about abortion in 1849 and was immediately in effect, making abortion illegal. West Virginia law prohibits D&E procedures and does not allow abortions because of a disability diagnosis. So if a doctor looks at the woman and says, this is what's wrong with your fetus, it's going to be like a really poor quality of life. That's not a reason in West Virginia anymore to get an abortion. And in West Virginia, the woman must face a 24-hour waiting period, counseling, and an ultrasound, and the abortion is not provided with public funding. Parents must be notified of a minor receiving an abortion, and abortion care cannot be provided with telehealth services. So, overturning Roe v. Wade, women were forced to carry non-viable pregnancies, and ectopic risk pregnancies can lead to serious complications. Physicians stopped medical treatment in women out of fear of legal prosecution, and providers were hesitant to abort ectopic pregnancies and non-viable fetuses, especially right when it was overturned. A lot of physicians were unsure where the law stood with their state. Physicians have left states where abortions are now totally illegal, and a lot of people who are residents in programs in states where there's a total abortion ban, they're not learning how to provide that kind of care. So a lot of resident rates have gone down in states with total abortion bans. Women receive delay in medical care when experiencing gynecological emergencies, which can very quickly lead to sepsis, mental health impacts, and postpartum hemorrhage. Maternal death rates increase because of hemorrhage, depression, and emergency surgeries. Roe v. Wade being overturned forced women to carry their pregnancy to term. They're more likely to fall into debt, rely on public assistance, and quit their job or quit schooling. Unplanned and unwanted pregnancies stop women from completing high school and college, and they are a lot more likely to be a single mother raising children. As I talked about earlier, women of color and low income are most affected because they have reduced healthcare access and reduced resources to travel to other states. And women carrying unwanted pregnancies or unviable pregnancies are a lot more likely to experience anxiety, depression, and fear. So my suggestion would be to reinstate Roe v. Wade and provide privacy back to all women in the United States who want to have a safe abortion. Roe v. Wade can provide a national standard of abortion care, and women do not have to cross state lines to receive abortions. A woman's rights do not have to change when she crosses into a new state. Unsafe abortions are still happening, and reinstating Roe v. Wade would ensure safe and private abortion procedures. Women would be more financially stable, they will receive more education, and raise children in safer and better homes, and a woman can have a child when she's ready. Roe v. Wade provides clear expectations for providers, and providers can provide abortions to women without fear of prosecution. Abortion laws significantly impact women of color, poverty, and rural communities, and reinstating Roe v. Wade gives all women, no matter your income or your race, the equal chance of receiving an abortion. In terms of West Virginia, I think that they should consider longer gestational times for women to decide if they want to keep their fetus. If West Virginia wants to keep the law saying if you're raped, you can have an abortion, I think that it should be longer than 8 weeks. A lot of women don't realize they're pregnant for quite a long time, which I know is alarming, but it's true. So I think extending past 8 weeks would help a lot of women. And I don't think women should be required to notify the law of rape. a lot of women don't feel comfortable reporting rape and reporting assault, which could be for a variety of reasons. Some states allow abortion pills to be prescribed with telehealth or mail orders, and this would allow West Virginia citizens to get an abortion in their own state and not have to drive to another state. And allowing abortions for a fetus with an anomaly would give autonomy back to the mother. Children born with anomalies may have a decreased quality of life that the mother may not want their child to face, and they may not be able to afford that. And although the West Virginia law outlines abortion is allowed in a medical emergency, women are still delaying their care out of fear. And I think further detail should be explained in the law, explaining what women should seek help for and what the physician is allowed to provide. So the policy framework I think that applies to Roe v. Wade is the multiple streams framework created by John Kingdon. It analyzes policymaking in various communities and countries, and it has an extensive impact and helps create policy that is universally acceptable for everyone. It believes that there are many different solutions to a policy issue, which really applies to Roe v. Wade. So the policy stream would be to focus on the negative impacts of abortion bans, such as economic instability, women leaving their jobs, unsafe abortions, and death. The policy stream would be to draft legislation or to focus on the steps necessary to reinstate Roe v. Wade. And lastly is the politics stream. Political leaders are necessary to create drastic national federal law regarding abortion. So this could mean getting people to go vote and electing new politicians. When, a spot opens on the Supreme Court, I realize we don't vote for the Supreme Court, but the president can appoint someone to the Supreme Court. So getting people to vote and electing politicians who want to see change in reproductive rights could create policy change, and promoting the public opinion on abortion.